store here. And from there, the police were given a description of the man they eventually encountered inside a car at the time. And according to police, this man physically resisted, and that's what sort of began the entanglement. Again, that's the account coming from police. We do know that there was body camera rolling throughout this encounter, though we haven't seen that just yet. What we have seen is part of that video that was taken by a bystander, where we saw, again, in part, these officers, one, having a knee on the neck of George Floyd. He repeatedly said, "I can't breathe," eerily similar to what we heard in 2014 with Eric Garner. And then eventually, he begins to seemingly lose consciousness, where his words begin to trail off. There are many people on the sidewalk that are asking to check a pulse, though that never happened. And by the time paramedics did get there and his body began to move, it was seemingly limp in how it was, again, handled by paramedics. Moving forward, I mentioned the 4 officers that were fired. The FBI is now investigating as well, along with state and local officials.
Omar Jimenez reporting there. A court in Israel has ruled a former Melbourne school principal, Malka Leifer, is mentally fit to be extradited to Australia. She's facing 74 charges of child sexual abuse from her time at the Adass Israel school. Her lawyers have previously argued she is seriously mentally unwell, but the district court in Israel found she was faking mental illness to avoid extradition. The ABC's Eric Torchek reports.
It's the decision Malka Leifer's been trying to avoid for 6 years. The former principal of Melbourne's Adass Israel School says severe mental illness should prevent Israeli authorities from extraditing her to Australia. But Israeli State Attorney Avital Ribner-Oron says the Jerusalem District Court has finally rejected that.
This decision today has removed an obstacle that has prevented the court from moving forward in this matter, and we look forward to the continuation of this case in a swift and timely manner.
It's a huge victory for Malka Leifer's alleged victims and their many supporters. Darcy Ehrlich's been leading a campaign to bring her alleged abuser back to Melbourne.
The first minute after we heard the decision, we just all couldn't breathe. We were in total shock, and emotions have just been growing since that moment. Can't stop smiling, can't stop laughing, just being totally overjoyed.
But the joy is tempered by frustration. It took a lengthy lobbying campaign, a hidden camera investigation, and allegations by Israel police that the country's deputy health minister interfered in the extradition process to get to this point.
We think that Malka Leifer successfully manipulated the system in the same way that she manipulated us. And the fact that she was able to get away with it for so long is shocking.
Malka Leifer's lawyer, Tal Gabay, says the decision ignores some psychiatric assessments that found she was, in fact, mentally ill.
שקשה מאוד לאמץ חוות דעת פסיכיאטרית שקובעת שהגברת לייפר.
It's hard to adopt only one psychiatric evaluation in this case, he says. My client can't fake her illness. She's been treated in a mental health clinic for the past 2 years, and this evidence cannot be ignored. The case will return to court in July for the start of extradition proceedings. Once they conclude, Malka Leifer's lawyers have indicated they intend to appeal to Israel's Supreme Court.
Reporting from Jerusalem. Brazil now has the highest weekly death rate seen in any country during the coronavirus pandemic. The Brazilian president, Jair Bolsonaro, has been keen to play down the effects of the coronavirus and wants lockdowns lifted so the economy can restart. But the death toll keeps rising, and officials fear the country hasn't yet reached the peak. CNN's Nick Payton-Walsh has more.
Well, here in Manaus, the worst hit city in Brazil, the worst hit country in Latin America, the worst hit region in the world, we've seen some startling scenes today that show the gravity of the problem and, frankly, the enormity of the challenge here in the heart of the Amazon to get the people affected by this disease to medical treatment. We've seen flights landing, bringing people in from far-flung places. We've seen startlingly large cemeteries built in a record amount of time, 1,500 people buried in one plot that we saw, and troublingly too, about 4/5 of them were suspected COVID cases, not people who tested positive. And that calls to question, frankly, the official numbers the Brazilian government are giving out. It varies between states, but the full tally of 374,000 confirmed cases may not be the entire number because it doesn't always contain suspected cases as well. They're now the second worst impacted country on the planet, but they are possibly a week to 2 weeks away from the peak still, and much criticism levelled towards Jair Bolsonaro, the Brazilian president. He called this a little flu initially, and as recently as the weekend was seen not wearing a mask in a rally of his supporters. Commonplace to see those rallies, and commonplace too for his messaging to be suggesting that it isn't as bad as everyone thinks and that the economy is certainly a priority. But it is quite clear here in the city of Manaus, this disease has been utterly devastating. The city so remote from the rest of the country and having to fly in so much support to keep itself going.
Peyton Walsh reporting. The Afghan government has released hundreds of Taliban prisoners and is calling on the group to extend a 3-day ceasefire. Here's the BBC's Lise Doucette.
It is such a sad measure of a country where just 3 days of peace they have to be grateful for, and how badly, profoundly Afghans want this peace and to continue. A time of tranquility, people are talking about, time for talks, a time for everyone to be able to confront the bigger enemy which they share, which of course is the spread of COVID-19, which is getting more serious by the day. But there still hasn't been any word from the Taliban. A ceasefire is very tricky territory for the Taliban. You may remember that at the end of February, when they signed a deal with the United States, there was no mention of a ceasefire in that deal. All they agreed to, and it wasn't in the text, was what was called a reduction in violence, because they feared that their fighters would be demoralized and demobilized, that if they thought that the Taliban were giving up the fight so soon, that they would join the so-called Islamic State and other groups, which would be enticing them to join their ranks.
Lise Doucette with that report. A couple of years ago, Facebook decided to dive into the issue of whether its website was aggravating polarisation and tribal behaviour. It's now emerged it commissioned a report but did nothing about its results. Jeremy Rees has more.
Facebook received the results of its internal report in 2018, but they've only just come to light. And far from bringing people together, it showed its platform was driving divisiveness. According to the Wall Street Journal, the report concluded the company's algorithms were driving people apart. It warned that if left unchecked, Facebook would feed people more divisive content in an effort to gain attention and increase the time that people spent on the platform. However, internal documents seen by the Wall Street Journal show that Mark Zuckerberg and other senior executives largely shelved the research and weakened or blocked efforts to implement its conclusions. Its reporting shows that Facebook policy chief Joel Kaplan argued at the time that efforts to make conversations on the platform more civil were paternalistic. For World Watch, this is Jeremy Rees.
Facebook says it's invested $2 million to support independent research proposals on polarisation. Iceland has reopened bars and nightclubs as part of its easing of restrictions. The country has been ahead of the game when it comes to testing for COVID-19, and the government says it has the pandemic under control. So when permission came, people headed to the dance floor. Deutsche Welle's Ola Aliasaka reports.
Monday night in Reykjavik. For the first time in more than 2 months, people could meet their friends out for a drink. And some were even ready to show off their moves on the dance floor again.
It's quite reviving being out again and seeing your friends. It's kind of feeling like it's getting back to normal. We're definitely getting rid of this virus. We're going, everything's going so well and we're heading for such a good direction. We want to keep it that way.
Mass testing and early tracing are being cited as the main reasons for Iceland's relatively low rate of infection, and only 10 people have died from COVID-19 in the country. But as Iceland's bars are allowed to reopen, authorities will be keeping an eye on the situation. Earlier this month, South Korea had a spike in infections after nightclubs were reopened there. For bar owners, the easing of restrictions is a blessing. It's just like being born again. It's been a hard period, but I think we'll come out of this strong. At least I hope so. While the bar is finally open, those who were hoping to avoid Iceland's bright nights and dance until the early hours under disco lights might be disappointed. 11 p.m. is closing time for now.
And that's World Watch for today. Back to you, Marnie.
Thanks, Annabelle. And that's Midday Report, Te Purongo o Te Paututanga for Wednesday, May the 27th. Stay tuned to RNZ for the Ministry of Health COVID-19 briefing with Ashley Bloomfield shortly after 1.
RNZ News at 1 o'clock. Kia ora, good afternoon, I'm Paul Brennan. Māori MP in the National Party caucus Jo Hayes is reluctant to repeat her earlier criticisms of the lack of Māori representation on her party's front bench, despite saying yesterday she intended to question the new leader Todd Muller. Ms Hayes told Radio Watia Mr Muller needed to give a better explanation as to why there was no Māori and remedy the situation. But when asked about her comments today, Jo Hayes refused to criticise the leadership. When Jo Hayes was asked about whether Mr Muller had told her not to speak further on the matter, she said that was not the case. Auckland's mayor has asked the government to allow the city to test run a quarantine system that will allow foreign students to return. Foreign students are a $5 billion industry for New Zealand. Phil Goff has proposed the students cover the cost of being quarantined for 14 days at a suitable University of Auckland hostel. He says the university where the students would study can also test them for COVID-19 if required. Mr Goff says if allowed, the students could arrive in a few months' time. In New Zealand is to time its flights in and out of regional airports to let business people do same-day return trips. The national carrier says customers in Hamilton, Tauranga, Napier, New Plymouth, Palmerston North, Nelson, Dunedin and Invercargill will be able to get to and from Auckland, Wellington and Christchurch in a day. It says catering to business will help the country's economy recover from COVID-19. The new schedule will start on the 8th of June. The government has launched a new plan today aimed at preventing seabirds from being harmed or dying due to commercial fishing. The National Plan of Action for Seabirds will work toward zero fishing-related...
Kia ora koutou katoa, malo soifua. Welcome to today's briefing. For the fifth consecutive day, there are no new cases of COVID-19 in New Zealand. So our total number of confirmed cases remains the same at 1,154, and the total of confirmed and probable cases is 1,504. There's one additional recovered case, and this total of recovered cases is now 1,462, and there are just 21 remaining active cases of COVID-19. There are no additional deaths to report, and currently there is nobody in hospital with COVID-19 following the discharge of a person from Middlemore Hospital. Yesterday, our laboratories processed 4,279 tests, so our grand total of tests undertaken to date in New Zealand is 267,435. Just an update on the NZ COVID Tracer app. There are now 422,000 registrations on that, an increase of 17,000 since yesterday. And just to remind people that even registering, and which provides your up-to-date contact details with the Ministry of Health, is incredibly helpful for both you and for us and our wider efforts. So I continue to encourage you, if you haven't already, to download that app. There are now over 17,000 QR posters available in businesses around New Zealand, representing that unique New Zealand business number, and those are the ones that work with the NZ COVID Tracer app. We're launching another app today called Awhina, and this is an app that is for health professionals and healthcare staff. It provides them with access to up-to-date information on the case definition, on local clinical pathways, and on guidance around use of personal protective equipment, amongst other things. So we're very pleased to be able to provide that information to our health professional workforce, so it's available on their mobile device and is updated as it is updated on our website. We've worked on that app with feedback and input from people across the system. And finally, on another important topic, back in Alert Level 4, I certainly noticed, and you may well have, there were many people out walking or cycling to get some fresh air and physical activity to break the monotony of being inside, and with less traffic on the roads. I have to say it was both easy and very enjoyable. Now, there is obviously more traffic on the road under Alert Level 2, but I would encourage people to still try and build in some physical activity into your days. I know it's getting more difficult with shorter and colder days, especially those mornings. But if you can retain that physical activity and build it into your day, perhaps for local trips, whether it's school, work or to the shops, that will help you stay well over winter. And what you may notice is your local councils providing more space for walking and cycling to make it easier. And I commend the councils for doing this and strongly encourage people to make the most of that. So we'll continue to work, as we have been, with the New Zealand Transport Agency, Waka Kotahi, and the Ministry of Transport around the public health benefits of walking and cycling, whether there is COVID-19 or not. I'm happy to take questions.
Would you be comfortable with the country moving to level 1 earlier than a month away?
Well, the advice we've given, and this was the basis for the Cabinet discussion and their decision on Monday, was first of all to move the group size up to 100 and then to remain in a full alert level 2 for a period of 4 weeks before moving to alert level 1. But I'm also aware, as the Prime Minister said on Monday, that they will be reconsidering the settings in alert level 2 on the 8th of June. So at the moment our advice stands, but of course the ultimate decision does lie with Cabinet.
Why do we need to stay in alert level 2 for so long?
Well, the main reason here is we're wanting to be really certain as we increase activities, the cumulative risk of which could lead to cases of COVID-19 in New Zealand, and also making sure that our border procedures are safe and very secure, especially as we contemplate a possible move to a bubble with Australia and or more people coming into the country.
Have you seen that Winston Peters this morning said that we should be in level 1 already and have a trans-Tasman bubble arranged? Would that even be a workable possibility at the moment?
Well, I can't speak for the Deputy Prime Minister's comments, and what I can say is that we are working hard on what alert level 1 will look like, and also separately, but obviously linked very hard with a whole range of players, including the airline industry, airports, foreign affairs, and of course our counterparts in Australia, on what would need to be in place to allow a trans-Tasman bubble. And of course, the key thing there is that will require both countries having confidence in the arrangements on both sides of the Tasman.
So that would be no for right now? This very, like today, tomorrow, immediate future, that would be a no then?
Well, it's, as I say, it's work that's actively underway, but it would require decisions, of course, from the cabinets of both countries before such a a trans-Tasman bubble could go ahead. And what our job is to provide, I think, really good advice on what needs to be in place, both in terms of the pattern of cases in each country, but also at the border and on flights to help make sure there was no risk of transmission of any cases between countries. Yes, so there was a review of the evidence in scientific literature a couple of weeks ago, which is the one on our website. We have asked for further advice from our different technical advisory groups, including our infection prevention control one, our overall technical advisory groups. There's not a unanimous view on any of those groups, but the weight of the view is still that our current policy, which is not to either recommend or require widespread use of masks, is the right one at this point in time, but we're just finalising that, and we will make an updated statement available in the next day or two.
Have you changed your position on wearing masks in places like public transport?
Not at this point, no, but we just keep actively watching that. I think, again, the use of masks, as with any of these measures, needs to be put in the context of the situation we are in right now, and alert level 2 going to alert level 1 with, I think, a record 5th day in a row with no cases and really no evidence of community transmission. That is the thing that will keep people safe, along with physical distancing and those other basic public health measures.
Mayor of Auckland, Phil Goff, says that he'd like to see international students who want to work at to study at the University of Auckland's medical school to be able to enter the country. Do you think it's safe to have some students come in if they're staying at hostels, paying to stay at these hostels?
This is a piece of work that is underway and discussions are happening and we're involved in them, led by our education colleagues. I think the key thing is any group that is coming into the country, and there's been publicity about some particular people with particular skills who have come in over the last few weeks under a special exemptions policy. Anyone coming into the country needs to do so in a way that is complying with those that 14-day quarantine or or managed isolation, except on very rare circumstances where we can be very confident the risk is low. So yes, that does open up the option of international students coming into the country, and we would need to make sure that all the arrangements were in place to do so safely.
What alert level will the country have to be at for you to feel comfortable to establish a trans-Tasman bubble?
I think that's not dependent on the alert level per se. It's dependent on both governments deciding that the risks are able to be managed with an appropriate process. So, and I think the Prime Minister said this on Monday, it's not dependent on us being in alert level 1, but it is dependent on obviously decision makers in both countries agreeing to it.
Going back to allowing some other people back into the country, would you still recommend that they stay at the hotels at Christchurch and Auckland, or would you imagine moving to a time that they could then return to start doing self-isolation at home and that sort of thing as we had before?
At this point in time, because the border is so important for us to keep the infection out of the country, we're maintaining the position that it requires either quarantine or supervised isolation at one of the facilities that are set up in Auckland or Christchurch.
Is this the first time there's been no one in hospital for COVID-19 since the pandemic lockdown began?
I think it is actually, yes. We have had a number of people in hospital, never a big number, but I think this is the first time, at least probably in a couple of months, that we haven't had someone in hospital. So that's another good position to be in.
Yesterday, you spoke a little bit yesterday about exemptions that you signed off on. You signed off on them all, and how many have you signed off for people in the screen industry?
So the ones in the screen industry I don't sign off on. They're signed off on by Minister Twyford, and they're related to specific commercial ventures. The very small number that I sign off on are around workers with very particular skills, like there were some engineers from Europe that came to fix the so-called poo pipe here in Wellington, and also one I mentioned yesterday who's here to repair some of the X-ray machines in district health boards around the country. But the ones that are actually about commercial ventures are not something that I sign off on. However, those all have to comply with the very strict public health measures that are in place for everybody else, so they require the 14-day quarantine period.
How many in total have been signed off?
In the latter category?
Both categories together.
So I've only signed off on a handful. I should say that those are people who don't then need to do the 14-day quarantine period when they come. They can come straight and go to, assuming they've fulfilled a number of requirements. In the case of the other group, it's somewhere between 1 and 200, but Minister Twyford is the person who will know the exact numbers there. Please.
On that point of allowing further people in, some of the arrangements that these people are quarantining overseas rather than quarantining when they get here?
Not at this point in time, but that is something we are looking at. You would need to be confident in the quarantine arrangements at the destination where they're coming from, at the point of where they're coming from, and be confident that they were following the same strict sort of public health measures we have in place here. So it's something we're looking at as a possibility.
So that is something that we can move to, of sort of there being a visa or something, a requirement and proof that they have managed to self-isolate and or quarantine in their country of residence before coming to New Zealand, and then they can go straight into whatever role they're in.
Yes, that's absolutely an option, and another option is, and we're seeing some countries do this, is requiring testing before people depart from where they, their departure point in a timely way. Both those are options, but at this point in time, we're not using either of those options, but they are options for the future.
Noting that the government's response to PPE requests internationally is currently no, can you say which countries have asked for help with PPE?
No, I don't know which countries have asked, but we can provide that information.
Going back to masks, you may have seen yourself some people wearing makeshift masks, scarves, etc. Over the mouth, nose area. Does that offer any value for people that are taking extra measures?
I'm not discouraging people from doing it. If you're going to use a mask or face covering, know how to do that safely, and it makes it even more important to be to use careful hand hygiene, because that's where the risk lies with use of masks or face coverings, is breathing into them and then potentially touching inanimate objects that we call fomites. And one of the things we've found here in New Zealand, even where we've done reviews of where healthcare staff may have got infected from, on more than one occasion, we feel it's because of contaminated surfaces, even though they were wearing full PPE. So I can't overstate the importance of people having good hand hygiene, whether they're using a face covering or not. Just perhaps one or two more questions.
Are you happy where testing numbers are at? Over the last few days have sort of dropped off a little bit, and is that to be expected as we drop down the alert levels, that there'll be less testing?
It's to be, well, first of all, we always see a drop over the weekend, and that tends to be flow through into the Monday and Tuesday numbers. It's coming up again today. I think we were, 4,279 tests processed yesterday. Yes, we will expect to see the numbers come down because for two reasons. First of all, through the last couple of months, we've been testing for people with symptoms. We continue to do that, and that is the vast majority of the testing that's happening. Anyone who fits that case definition on our website, which is very broad still. But secondly, we were doing a lot of testing to try and identify if there was any hidden virus out there in the community. Now that it's clear it's not, we'll be shifting the focus for that testing to the border, because that's the area where we will have the most risk. And there is a very specific plan that is being developed around that, which will, once it's been through Cabinet and approved, is intended to come into operation from the 8th of June. Again, the focus will be on testing people with symptoms, and then looking to make sure we're identifying any possibility that there's been a breach at the border by regular testing of people there. Sorry, there was a follow-up question.
Sorry, I was just going to say, because of our success in tackling COVID-19, is it going to affect our chances, if there's a vaccine created internationally, will it affect our chances of getting the vaccine if we're a country that's seen as doing well and doesn't need it as badly as other countries?
I shouldn't think so. It's still a long way off for a start, and secondly, as you will have seen in the vaccine strategy that was publicised earlier in the week, we've got a number of irons in the fire there to make sure that we have access to a vaccine as soon as one's available, and also planning for making sure that we can vaccinate our population.
So just following up on what you were saying there about new testing at the borders, does that mean we could see more people coming through the borders?
Regardless of whether we're seeing more people coming through the borders, what we're looking at is whether we routinely test everyone coming through the border at some point during their quarantine period, but also it's about testing of people who are working at the border, either at airports or ports or in those quarantine facilities. So that will be where the focus of our asymptomatic surveillance testing will be in the future.
You said about the different views on masks. Can you outline, does it come down to thoughts on public transport use, or is it more general recommendations from the government on masks? Where does that discrepancy lie at the moment?
They're both related. So I think there's just a range of views on whether widespread mask use, whether it's on public transport or in other public settings by the general public, is worth doing from a sense of that the benefits outweigh the potential risks at this point in time. But it's just one of those things that's under active consideration. Final question?
From our sports team. The Tokyo Olympics have been postponed to the middle of next year. Do you think a vaccine would be ready by that time, and do you think the Olympics should go ahead if there isn't a vaccine and you're going to delve backwards?
Well, I'm prepared to answer most questions, but I don't think I can offer any sound insights into that particular issue. I'm sorry. Okay, thank you very much, everybody.